Hi everybody, welcome to Therapy Corner. I'm Dr. Amelia Aldeo. I'm a Yale-trained clinical psychologist, and today I wanted to talk to you about obsessive compulsive disorder, or OCD. So what's a gold standard therapy treatment for OCD? Once again, it's CBT, cognitive behavioral therapy, but a very specific type of CBT that is called exposure and response prevention, or ERP. So ERP is based on the assumption of exposure, which is what we do for treatment of all anxiety disorders, which basically means that we help clients face those situations that make them particularly anxious. And the idea is that the more that people do this, the more they overcome their anxiety, the more they realize that they had played up anxiety in their head, that it's never as bad as they thought it would be, and that they're much better equipped to deal with it than they actually thought. So for OCD, it's a specific type because what we do is we expose our clients to situations that are likely to trigger intrusive thoughts or images or impulses, right? So we expose them to those unpleasant experiences that are full of anxiety, that are full of stress, that likely trigger the compulsions. And what we prevent is we prevent them from engaging in the compulsion. So if somebody has contamination concerns and they have all kinds of intrusive thoughts every time they go on the subway and they touch the pole, what we're going to do is we're going to have them do that. We're going to have them go on the subway, touch the pole, and begin to feel the anxiety, begin to feel the intrusive thoughts, and then help them prevent the response, which in this case will be some sort of compulsive hand washing. So the idea here is to stay with that anxiety, to work through it, and to resist the temptation of engaging in the compulsion. Remember, the compulsion gives some amount of short-term relief, if anything, but it definitely exacerbates the anxiety and the intrusive thoughts over time. So we help people resist the temptation to engage in the compulsions and the rituals. It's very similar in many ways to the way that we do treatment for alcohol or for substance abuse. We're empowering the clients to actually find ways of resisting the temptation to use the substances. So here we're empowering our clients to resist the temptation to engage in compulsions. And guess what? The more they do it, the more they resist the temptation, the more they stay with their anxiety, the more they work through it. The less anxious they are, the less intrusive thoughts they have, and more importantly, when they do have intrusive thoughts, the better equipped they are to manage that anxiety. It's a fascinating treatment. I love doing it. Now you have to be very creative because, as I mentioned before, people have all kinds of obsessions and all kinds of sophisticated rituals. So it's very important to keep in mind that this is not a black and white approach. So we're not expecting clients to resist the temptation to engage in compulsions 100%, right? So if somebody has a very complex hand washing ritual, we're not expecting them to stop doing it altogether. Right? We are going to set up different gradual steps. So for example, right, they're going to do a shorter ritual, or they might try to not do it right away, right, to increase the latency between having the intrusive thought and engaging in the ritual. Or we may modify the ritual so that it takes less time. And slowly and gradually, we help the person let go of the ritual, let go of the compulsion, sit with their anxiety, and find better ways of managing, of dealing with the intrusive thoughts. So from the cognitive perspective, much like CBT for all the other anxiety disorders, we teach our clients to think about their anxiety differently. And more importantly, to embrace uncertainty. So remember in the example before, I said that the person was 99.9% sure that they had locked the door, but that 0.1% was manifesting itself in all these intrusive thoughts and in all this anxiety. So what we try to teach clients is to be okay with the fact that they can never be 100% sure of anything. It's about embracing uncertainty. And the more they do that, the more they're okay with that 0.1% or 1% or 10%, whatever the number is, the more comfortable they are with uncertainty, with not being able to be 100% sure of everything, the more power they take away from the intrusive thoughts. And the more they do so, the better equipped they are to deal with them when they come up. Right? So the goal of treatment is not to eliminate the intrusive thoughts, but it's actually to be able to take away their power when they do come up. And the more we do that, the less frequency they will begin to pop up, and the less anxiety we will feel. And then the less tempted we will be to engage in compulsions in the first place. But remember, because we do the exposure piece, when we do feel tempted to do the compulsions, we are equipped to begin to let go of that tendency. And that is how CBT treatment works for obsessive compulsive disorder. If you suspect that you or someone else in your life has OCD or any other mental disorder for that matter, please consult with a mental health professional. And as always, if you have any questions, any comments, please leave them in the section below. And if you enjoy the content, please like the video, subscribe to the channel, and share with people in your life. Thank you so much, and I'll see you guys next time. Bye bye.